Yeah. Okay.
Okay, good morning everyone. Thank you for coming in my presentation. This is Mahfuza Nargis. Today I'm going to discuss on topic about sickle cell anemia, a burden in Nigeria. To discuss about my whole presentation, I would like to give you some description about what is sickle cell anemia. Sickle cell anemia is the most common sickle cell disease among the world, and it is a genetic blood disorder which is inherited from both affected parents. When point mutation occurs in a hemoglobin beta gene, then abnormalities occurs in the beta hemoglobin, which gradually turns to the disease sickle cell anemia. And hemoglobin S is the main responsible for occurring this sickle cell anemia. Sickle cell trait, the one of the most important term. Sickle cell trait is not a disease, it's a condition, but it can cause disease in the future. A person with sickle cell trait is a carrier, and the research shows that the 5% of our total world population is carries sickle cell gene. In my left hand side figure shows the genotypes of the sickle cell anemia. If both parents are carrier, they have 25% chances of having sickle cell anemic children. And if one parent is a carrier and one is a affected, so they have 50% chances having a sickle cell anemic children. Now come to the life expectancy. The average life expectancy of sickle cell anemic patient is 42 years for men and 53 years for women, but it varies in developing country to developed country. Research shows that developed countries' life expectancy is higher than the developing country. Now, pathophysiology of sickle cell anemia. It's an autosomal recessive. When amino acid valine replaces glutamine from position 6 of beta globulin chain, hemoglobin is formed. This hemoglobin is actually create the abnormalities in beta gene. Two copies of hemoglobin is main responsible to create sickle cell anemia. Hemoglobin S beta gene has a great affinity to bind with other hemoglobin S beta gene in deoxygenated situation, and this condition known as deoxygenated situation. So in this condition, it turns normal shape of our red blood cells into rigid sickle-like or crescent-like shape, and this condition actually known as polymerization. Due to the rigid and sickle shape, these red blood cells adjacent to the vessel wall, and that's why it's actually obstruct the normal regulation of the normal blood regulation of the blood flow, which causes two major condition, vasoocclusion and hemolytic anemia. Prevalence of sickle cell anemia. Well, the sickle cell anemia is highly prevalent in the sub-Saharan Africa, Mediterranean, Caribbean, and most of the prevalent in the some region of Africa like Nigeria, Ghana, Uganda, etc. According to the WHO, every year 300,000 babies born with sickle cell disease, and whereas 70% babies born in the Africa. And according to the research that though 15 to 30% carrier we have found in the Ghana and Nigeria, but Uganda is known as the highest sickle cell trait country among the world, because Uganda has exists 45% sickle cell trait. So now the question is why this area has highest rate of the sickle cell anemic patient of sickle cell disease. Research shows that the higher rate of sickle cell disease exists where malaria is endemic, because the sickle cell patients have a high resistance against Plasmodium falciparum. Here is a map shows that this area is where malaria is common, and the same map here shows the same areas where is malaria is common. Their hemoglobin S gene frequency is higher. Like this red area shows the highest frequency of the hemoglobin S gene. Now, what is the signs symptoms of anemia? The common signs and symptoms of anemia is fainting, low blood pressure, shortness of breathing, acute chest syndrome, and angina, paleness, etc. And alongside with this syndrome, splenomegaly, retinopathy, sequestration syndrome, dactylitis, stroke is also happen. This is a picture of a baby who is suffering from head-foot syndrome, which is known as dactylitis. The babies have sickle cell anemia. Now come to my main point, which is sickle cell anemia in Nigerian children. Nigeria have 112 million of population. In this vast population, they have 50% the population. 50% population are affected by sickle cell anemia. Annually, 150,000 children born with sickle cell anemia only in Nigeria. And according to the WHO, every year 100,000 babies dies due to this fatal disease. And in this vast account, 8% children are in under 5 years. So considering all these points, Nigeria is now known as sickle cell anemic country among the world, and also known as the sickle cell disease burdened country among the world. Here is the graph shows the vertical axis shows the percentage of the deaths, and the horizontal axis shows the age group of the children, where we can see that less than 2 years old children mortality rate is higher than the other age group of children, and following that less than 5 years children's higher mortality rate is higher. So in this from this map we can prove that higher mortality occurs in less than 5 years children mostly. Now, how can we investigate sickle cell anemia? Screening test is most important and also effective preventive way to investigate sickle cell anemia. Neonatal screening test is most important, and also the main important is hematological test. Through this test we can observe the morphology of the blood cells, blood cell count, and alongside with this test for more confirmative to getting more confirmative result, electrophoresis, LDH, bilirubin, and PCR, that is polymerase chain reaction, chest radiography, bone radiograph also done. This is the microscopic examination of a red blood cell of a blood film. It shows the sickle shape of the RBC in case of sickle cell anemic patient, and this is the result of the lab examination of sickle cell anemia, which shows the WBC count and the reticulocyte count is higher than the normal levels, and whereas hemoglobin count is much lower than the normal level. Then now, how can we manage this disease? First of all, before birth, if parents doing screening tests when they expecting a child, or when the person want to get married, they should do a screening test, because so it is it can prevent the higher risk of the sickle cell anemia. And also in healthcare management, neonatal screening test is most important and most effective. So if we can get a baby with sickle cell disease, we can start our treatment as soon as possible. Well, if we found out any children with this disease, as soon as possible, give the children antibiotic drugs to inhibit the infections. And then hydroxyurea is most commonly used for manage sickle cell anemia and also pain crisis. Also, there's some medicinal plants could be used alongside with the pharmaceutical drugs, because it is cheaper and most available in the African regions, and its cost is so low. And this medicinal plant is like leaves or seeds or leaves of citrus sinensis or any seeds or like this. Preventive way also help to manage sickle cell anemia. Social awareness, educating people, and early and regular diagnosis also help to manage sickle cell anemia. Now, pharmacoeconomics. This table shows the average expenditure of laboratory tests, drugs, and hospital utilities of the per person, and the following this, the monthly family income and the percentage of household the income is spent on the children's treatment. So from this table we can see the upper social class expenses less than 5% of their family income on their child's treatment. On the other hand, lower social class spend more than 30% expenditure of expenditure on their behind the treatment of their child. So now coming to the conclusion, we in all the discussion of the point, we know that the sickle cell disease is the fatal disease, and yet now we have not found out any curative method, but preventive way and early diagnosis can help us to reduce the mortality rate, to reduce the risk of this disease. So arises awareness, better management, and educating people can help us to reduce the child mortality in Nigeria, and also reduce the risk and the critical condition of these children. So this is my reference list, and thank you very much for your patience.
There you go, thank you. So, are there any questions?
I know you guys will say I'm asking.
Oh, let me ask a question. Okay. Please go back to the slide where you showed the money. Yeah. I don't understand.
Are you saying that if we're able to eradicate malaria in Nigeria, the rate of sickle cell will reduce? Or is there other factors that we need to consider as well?
I'm not. I was not telling like I just told that where is malaria is endemic. The research shows it's not a 100% proof that where is malaria exists there is a sickle cell anemia, because like Asia there is malaria not is endemic, but in Asia they have also sickle cell anemic patients. But some study shows that where is malaria exist highly, there are sickle cell anemic patients found in highly comparatively other areas, because the patients have naturally have some criteria that can resist the infection of the malaria. That was my point.
Okay.
Following on from that, so if you have malaria in 2 different countries and you have sickle cell in 2 different countries, is the genetics the same? Is it the same mutations, or are there different mutations depending on where you are?
Okay, 2 different countries.
Yeah, so you say you've got, so there's the sickle cell in Africa, Nigeria, sickle cell in Southeast Asia. Is it the same mutation which causes the sickle cell? Is it still that B to E mutation in whatever protein it is?
Yes.
Is it the same mutation?
Yeah, same
Wow.
the main cause of the sickle cell anemia is same mutation.
I've got no idea.
The father will have to be AS.
Yes.
The parents will have to be AS.
The way mutations work,
Yeah.
So it's
the
just the same.
geographical.
It's the same, it's the
thing
same.
Actually,
Is it the same mutation?
Same mutation.
The
Same
environment
mutation.
is allowed in
Because-
mutation, so like.
Yeah,
Because
but-
mutation occurs in the hemoglobin
So
chain.
they should be different in 2 different regions of the world,
Yeah,
you should
'cause
get
it's-
different
it's-
mutations.
You should, just
Yeah.
because it's a spontaneous mutation,
Exactly.
which causes a genetic.
Yeah.
Mutations are never the same.
Ever is the same because the mutation occurs in the hemoglobin
It depends
chains.
on where you are.
Like normal
Yes,
people have
yes.
2 alpha chains, 2 beta chains,
Yes.
and this anemia occurs when beta chains occurs
Can
from
we, sorry,
abnormalities.
can we give the answer, please?
Well, the mutation actually same because the mutation occurs in the hemoglobin chain, and our normal healthy person in our hemoglobin consists of 2 alpha chains and 2 beta chains, and the abnormalities occurs actually in the beta hemoglobin chains. So, the main reason of the sickle cell anemia is the same in all the country, but the maybe higher risk of the risk rate is maybe different from the country to country.
Okay, it's really interesting. So, have you heard of beta thalassemia? This is also a blood-borne disorder. There's 9 different mutations which lead to beta thalassemia, and they are geographically confined. So, in each different part of the world, they've got a very specific. Even between Greece and Spain, which are the 2